And now Shirley Dinkel will talk about classroom to community harmonic convergence.
Nice. Thanks to you. Well, thank you for this. Thank you for this opportunity. The original title was Implementing Patient Care in Public Housing, but it really was a harmonic convergence that came together to create an innovative healthcare design and academic practice partnership. I come from a long team of disruptive innovators, and I'm really thrilled about that title in our talk for tomorrow. I think disruption is not necessarily a bad thing. So Pine Ridge Family Health Center is the only known primary care center in the nation that is owned and operated by a public housing authority. We offer primary and urgent care services. We're an NP-led healthcare center and is a dedicated training site to DNP students. In the last year, we've only been in existence for 1 year. We started from the ground up. We have had 777 unique encounters with 359 new patients coming to our clinic. We were originally designed to only offer services to those in the Pine Ridge Manor neighborhood, which is the largest public housing and oldest public housing neighborhood in Topeka, Kansas. But we quickly found out that there were many people across Topeka who were in need of services that only this clinic was able to offer. The best part about this clinic is that we have substantial and amazing community support, all the way from collaborating physicians to volunteer nurse practitioners to services donated by various medical institutions within our neighborhoods. We also have collaborations with Grace Med, who offers oral health care for children within the clinic, and as I said, individual NP services. The other great thing about this community clinic is that it's supported by residents from the very beginning. They participated in focus groups. They helped us to refine the community assessment survey. They helped us to administer the community assessment survey. They even named the clinic themselves. There was a competition for naming the clinic, so they did that. We have community neighborhood residents who come and volunteer at the clinic. And they also participate in getting the word out for this marketing opportunities for this clinic. The third thing that we have at this clinic are fearless staff. We have Dr. Jane Brown, who was originally faculty at Washburn University, who assumed the position of full-time NP at this clinic. And then we also have the health services administrator, Lori Sodeman, who is probably the third most optimistic person I've ever met in my life. And I'll tell you about the other two here in just a moment. And then we also have another staff member who is a Bonner Leader student, Patricia Hernandez, who is a first-generation student of Hispanic origin who comes and provides translation services. And the clinic has raised some donations to pay for her employment at the clinic. Recently, the Topeka Housing Authority has won the Ad Astra Award for Excellence in Housing by the Community Housing Association and has been recognized by the Regional Department of HUD most recently, which is like super exciting for them. The impact of poverty in Topeka, this is why we're here. Why is Pine Ridge Family Health Center important? We provide health care services for those who are challenged to access care through other means. We are embedded within the community, and we think that's absolutely key. Grace Med, another public health agency, is about 1.5 miles from our clinic, but when you have 5 kids that you're trying to get to the clinic, you have to buy 5 bus passes there and back. You have to make it in time to the bus stop, and you also have to hope that the bus is running on time, because if you miss your appointment, you don't get to keep your appointment. You have to reschedule. We address multiple social determinants of health, especially transportation, access, and costs. Harmonic convergence at its finest. I'm still really trying to wrap my head around how this happened, and Barbara is trying to help me a lot. Thank you, Barbara Brandt, for doing that. To me, it's just a damn miracle, and I'm so excited, but I'm going to really try to explain how some of these pieces fell into place to make this clinic happen. There were 2 things that happened simultaneously. One was that I had a random email from the Nexus Institute about an opportunity to apply for an IPE grant to develop an IPE program. And we thought, oh, this is super cool, let's do this, and we'll create an IPE curriculum. And our goal was to teach students how to create sustainable innovation within their own communities. We have an online DNP program, and we thought this curriculum could go out to the rest of the world. At the same time, we had a reluctant conversation. Dr. Jane Brown dragged me over to the Pine Ridge Prep and said they need nurse practitioners to volunteer, to do healthcare services to some of these preschools for their preschool physicals. And I said, Jane, I don't want to go. I'm too busy. Everybody wants free care. Oh, my God. And she said, Shirley, get in the car. So I got in the car and we drove over. And we went in and we talked to Mallory Keefe, who was one of the social workers there at the time, who was serving this community through Parents as Teachers and through the Pine Ridge Prep preschool. And we were talking about how children's ACE scores in this community were incredibly high, which has the potential to impact their learning and impact their lives for the rest of their lives. And all of a sudden my head popped off and I thought, we could do this, or we could do that, and we could do this. And we started to create this collaboration that had been there all along, but not at the level that we had always hoped it would be. And through the IPE invitation, and then through this invitation with the social worker at Pine Ridge Prep, we brought these two pieces together and tried to redefine what that Nexus project was going to be. So we moved it beyond the curriculum to creating a clinic from the ground level up. For $50,000, yes. So I'm going to talk about these pieces kind of separately as we go through. So we did create the curriculum. The C2C team is one of the very unique experiences as part of this team, because we have from Washburn University the Officer of Sponsored Projects. We also have folks from the School of Business, from the Small Business Development Center, from Communications, and from Nursing. The reason why we chose this was very logical for us. We're one of the few DNP programs in the nation that requires students to take business courses as part of their regular curriculum. So it was a natural connection to extend that invitation to explore what a clinic might look like at Pine Ridge Manor. The Department of Communications we've worked with for a long time because we were interested in health literacy and how do we expand health literacy within our clinical experiences. And so with these 7 people, we created the IPE curriculum. And these modules have been established with assessment criteria, and they're available to all members of the Washburn community. All but 2 of these, we've had 4 DNP students and 4 students in the Department of Communications students who have completed their final projects at the THA neighborhood and at Pine Ridge Family Health Center, and all but 2 of those have involved residents from the very beginning who offer regular input. So I want to talk a little bit about the keys to our success, because we're still trying to figure this out. We do have a unique IPE partnership, and the other thing is that Washburn University is one of 2 universities in the nation that is a municipal university. So we're vested within our community. We get sales tax dollars from our community. So we always look at that reciprocal relationship in all of the programs that we do within our community, and that makes us lucky. Our vision statement says that. Our mission statement says that. We also have 2 programs within Washburn University, the High Steps program, High Impact Community Engagement, and we also have CTEL, which is the Center for Teaching Excellence in Learning, and both of those programs help faculty to decide the best ways to figure out how to engage in scholarship with the community. Recently, we have an initiative where we're going to be Nursing is going to champion this. We're going to look at how do we identify the scholarship of community engagement as part of promotion and tenure, because not only do you have to have communities that are supportive, but you also have to have academic partners and leadership that are supportive. So we're working on a way to incorporate that into promotion and tenure. The other thing is that residents have been involved in every step of the way. And we talk about this as a co-creation process. We use community-based participatory research framework to design our community assessment. As I said, we took a community assessment tool from IHI and adapted it. We included some questions on financial literacy. We included questions on health literacy. And then we modified it a little bit. And then we had a focus group. And we talked about the focus group and we said, what do you want? What would be your ideal thing to have happen here in this clinic to address these healthcare things that you have identified? And they said, we need a clinic, and we need these 3 things in the clinic. And they identified vaccinations for their children, dental health, and mental health. So we started with primary care to include vaccinations for everybody. We are partnering with GraceMed to begin to include dental health, and we are now working on a new grant to assist with providing mental health services within this community as well. Residents will be part of that process all along the way. Topeka Housing Authority and THA Inc. also have a strong commitment to community. I said Lori Soderman was the 3rd most optimistic person. Trey George, who is the CEO of THA Inc., which is the nonprofit side of the Housing Authority, he always says yes. Every time he says yes. And he'll say, I don't know how we're going to make it happen, but the answer's yes. And I think that has been critical to the effectiveness of the 2 teams that have come together to make this happen. So for example, he said, yes, we're going to do this. And so then what did he do? He took a 4-bedroom unit that was in this neighborhood and gutted the whole unit and created a 3-bedroom primary care clinic with a small lab and a waiting area. And I've worked in multiple clinics in low-income populations, and is the best-looking clinic I have ever seen. And so people who have come to name this clinic really see it as a source of pride for their neighborhood, that they have this clinic in their neighborhood and they got to be part of that process. Sophie George is the CEO of Topeka Housing Authority. She's the 2nd most optimistic person that I've ever met in my life. And she supports THA's initiatives to carry healthcare forward. We've reached out to an optometrist in a nearby community. That optometrist has donated an entire optometry unit to be put into the new partnership. They're going to gut the next building and offer mental health on one side and optometry on the other side, so that he's always reaching out to other folks to support the community. So another example that he did is that we figured out we could do the clinic, build the clinic for essentially not much overhead, because he already had the building. They wouldn't have to pay rent. They wouldn't have to pay utilities or anything, but it was, how are we going to pay the nurse practitioner? And so he reached out to a local group, the Advisors Excel, who offered the first year's salary for the nurse practitioner, and then they came up with the salary to pay for the health services administrator. The next step is to hire an RN, a BSN prepared RN, so that we can now connect Pine Ridge Family Health Services with another grant that we recently received, where we move RN students from the acute care setting into the ambulatory care setting, and then that person will precept students who are coming through the program. I mean, the connections are out. Do you see why my head popped off? I don't know how to explain how this happened. The other thing is that we embrace chaos, because if it can go wrong, it will go wrong, and you just have to be able to adapt to that and roll with that. And while we don't always do it very gracefully, most of the time that we do. So where do we go from here? I think we have 3 things that we need to consider. The first thing that we need to consider is the clinic. And right now, I've talked about some of the expansion opportunities that we may have. We need to continue to work with community support. But we have that. We've got that community support, so that's awesome. We also need increased resident participation. We've recently created the Advisory Council. We have a resident on the Advisory Council, and there's also 2 residents on the Topeka Housing Authority board. And for the clinic, what we need to do next is we really need to begin to develop some outcome measures about, are we doing what we think that we're doing? Right now, we already know that we've decreased emergency department visits because people report that when they come to the clinic to see us. As far as the curriculum is concerned, we are working with 3 different grant opportunities to expand services to this community so that students will rotate through Pine Ridge Family Health and really think about social determinants of health and how they advance their own practice. We also have taken work through the nexus with the Kennedy model of sustainability. We have adapted that model to kind of guide where we go from here and are working on some dissemination opportunities with Dr. Kennedy. We also are going to expand our IPE curriculum to the School of Law, Poverty Studies Department, and the Social Work Department. And we're actively working on a poverty simulation at the end of this year, which we received an internal grant to do that. And thirdly, what I would like to say about where we go from here, the National Center has developed a repository of tools to help us measure our IPE experiences. And the 16 schools that were chosen for this IPE grant are using those tools and reusing those tools so that we can develop some outcomes based on, not from the patient's side necessarily, but from the provider side. Lastly, I'd like to talk about some of the qualitative data for those of you who are qualitative lovers. I am one of those people. I believe we need stories and data. And here we have an excellent quote from one of our patients at Pine Ridge, one of the Pine Ridge residents. It's nice to know we're already making a difference in one encounter with one patient in one Topeka housing community. And we must say thank you to all the folks who have supported this. Again, this clinic started on $50,000 plus a donation to pay for an NP salary. And we're already making an impact. We're so excited. And thank you for allowing me to share this opportunity.